Hello there everyone and welcome to another episode podcast with Feel Good with me. I'm your host Idan, and today I have the great pleasure of introducing to you Dr. Adigo Atabo. And she's quite special. She's special in a skill. Unfortunately, I had a few operations in my life, and when they stitch you back up, this is a real art. And ideally you would have a plastic surgeon at every operation you have, because the layers of the skin has to be precisely neat. And I can't emphasize what a skill it takes, an eye for detail and a very stable hand at work here. So it's a true art, and that's what she was originally trained at. And thankfully she found integrative medicine and brought that into the table to help a patient, and she can tell us a little bit more about that as well. But what I wanted today to talk to you about, Dr. Adigo, it's how you use a whole mind-body approach in your practice, and how you can offer help or suggestions with your practice, and how also we can touch a bit about plant-based nutrition, which we're both advocates of, cruelty-free, and of course it's what our body run. For me, I'll just throw it quickly out there, the body is 70% water and fats don't mix. So if you eat high liquid, of course it helps. And anything you can share with us for autoimmune, post-viral, some supplements. I'm big on vitamin D3. I've seen it's helped me a lot. So things like that. But tell us a little bit about your background a bit more, and how you got into medicine, and how you discovered a whole mind-body approach. That's really helpful, and it's very different. There's not enough doctors doing that, and I believe you were also the first in the UK. So the floor is yours.
Oh, well, thank you for having me, Idan. It's such a pleasure to be with you. I so admire what you're doing with your podcast. So yeah, it's an honor to be with you. So I'll just start with what you finished with, which was saying the first in the UK to do a mind body. There have been doctors practicing this way for generations, and some of them my mentors and some earlier. So I was the first doctor in the UK to be certified with the Institute for Functional Medicine. But prior to functional medicine, there's been ecological medicine, and it's been called all sorts of things. So yeah, I was smiling as you were introducing me and talking about the finesse of surgery with plastic surgery. I just adore that attention for detail, as you mentioned. So I think partly that has been a theme throughout what I've done. It fed me going into medicine. I wanted to study broadly, but also have lots of detail to work with. So I initially trained as a plastic surgeon. And then I decided that I really wanted to explore my interest in nutrition, which I've had. It's just been part of me from as early as I can remember. And so I discovered functional medicine as containing training in nutrition. And so I became certified as a functional medicine doctor. And bringing the two together, the eye for detail in plastic surgery and just the network systems approach in functional medicine has been wonderful, because it's really just allowed me to see a new perspective of disease and the body, and not be afraid of the detail, to actually dive into it as the basis for helping people manage disease.
Amazing. Thank you so much for that. So maybe you can tell us, because something with people with like myself, with ME, fibromyalgia, IBS, we feel often lost. And when we go to a GP, as kind and helpful as some GPs are, I was very lucky, my GPs was very supportive, but so you have bloating, maybe you can try that. You have loose stool. Maybe you can try that. But it's just medicine, and I just felt it's really focused on the symptoms and not on the reasons of what's going on. Yes, if you push, they'll send you to a gastroenterologist that may put some cameras up and down in it, and that's great. But bottom line, even the gastroenterology, which I really found an amazing one, I think it was in St. Thomas Hospital, guys. He just wanted to give me all type of an antidepressant to slow down my digestion so I don't run 20-25 times a day to the bathroom, which it is extreme, and maybe it would have helped. But discovering a gluten-free vegan diet stopped all of that, and the side effects are just a bit better skin and a little bit better energy. And of course, later I discovered the ethics of that. So it's just nice for the mind to know you don't hurt others where possible. So maybe you can tell us how it's different in your kind of field. If somebody came with such symptoms, how different it is. And
I love that question. I think traditionally medicine is practiced in silos. And so just what you were describing, you have doctors who specialize in different areas. And so when you go to a gastroenterologist or you go to a neurologist, they're looking at a part of you, your nervous system or your gastrointestinal tract. But in reality, in nature, we don't exist in silos. We are interconnected, right? And so to look at one part of you without looking at the rest of you misses a whole lot of information. And that relates to what we call disease, right? So when you say I have ME or I have diabetes, what you're describing is like an end manifestation of dysfunction. And so all people who have a particular disease might share certain features. But how did they get there? That is going to be different from person to person. And so without looking at the whole system, you really have no appreciation of what the imbalances are in an individual, because you can have two people who have the same disease or the same symptom, and they have different imbalances in the body. And you can have two people who have the same imbalance, but they have different symptoms. So you really need to get a map, a framework of the person as a whole to truly understand what's going on with them.
Yeah, I appreciate that, really. It makes a lot of sense. And yeah, when you treat the person as a whole and the circumstances and all the lifestyle around, the improvement, like I said, won't be just I will be going less to the bathroom, but still being pale and in cramps. But the cramps will go, the color to the skin will come back, the bathrooms visits so frequent will be reduced. The joint all of a sudden feels better. So absolutely. Let's
Well, that kind of speaks to another point that you were saying, Idan, which is where one thing has many effects, right? And that is a demonstration of the fact that we are systems. We are not individual pockets of functionality. And so, as you say, you change your diet and you notice your skin is different, your bowel is better, your energy is different, and it's like spreading out in many different directions. And that's very encouraging for us, for individuals who have conditions, because it means there are many ways of feeding into managing a condition. It's not just one thing. So it's not a one pill or a one size fits all. There's no golden bullet, but it's exciting that there are many things we can do to try and make a difference to make us feel better.
Yes, true. For someone listening at home, and I know it's very difficult to give some basic rules to improve, but something like we can think of 3 quick things. We can answer that a bit later. 3 quick things that people listening at home at different levels maybe apply to them or maybe a bit less. that you usually advocate. We can touch that, would be great. And also something which I've noticed, my background is in psychology, and nutrition is always something I was interested in. I've seen how people struggle to adapt and to change. I guess habits, if they need to reduce the drink, the smoking, staying up late at night, putting the phone away, an hour or two before going to sleep, less coffee. Maybe coffee is all right on some level, I don't know, gives me the jitters, and like shakes and stutter somehow. I guess I got some sensitivity. There's a specific sensitivity. I will find the name for it a bit later. But so maybe you can talk about resistant to change and struggle to change. And then later, as I spoke about some stutter and some brain fogs, you can tell us a little bit about your other research and work in the field of dementia and Alzheimer's. And I know it's different to brain fog, but maybe there's something you can share with us that can be helpful to us going through struggling to remember something, to refocus. So I know I'm throwing at you a lot of different things, but just take your time and whatever comes, it's good.
All right. Well, I think rather than describing something in abstract, let's take a condition and work through that. And that'll allow us just to see the complexity and the different layers with which we can approach things, right? So you mentioned brain fog, right? So brain fog is typically, it's a vague term that people use, but it's like a blurring or interruption of normal brain function. And it can be transient, right? So when we say brain fog, we're talking about many different things. So I like to think about effects that are happening on a cellular level and in terms of the body's physiology, and then events in our lives that influence those effects or cause those effects, right? So there are things that happen to us, and then there are effects that those things produce in the body. So even though events might be first, I'm going to start just by describing some of the effects to start with, right? So in terms of brain fog, what is central to brain function is energy production. Energy production occurs in the mitochondria. Now, there are things that are needed for optimal energy production. So having enough oxygen. Glucose produces the most efficient energy production in the body. You need to have micronutrients to drive energy production, right? And then there are things that impair energy production. So having lots of reactive oxygen species around disrupts your energy production. Having toxic chemicals on board is going to disrupt your energy production because it interferes with the chemical pathways. And so another kind of mechanism that is involved is your hormone regulation. So what drives our energy production or feeds into it are the levels of hormones in the body. For example, the thyroid hormone, which is a great hormone for rest and repair. When your thyroid levels are adequate, your hormone levels are adequate, then people tend to have sort of more energy, they're more vibrant, right? Another mechanism that's important is, we kind of mentioned reactive oxygen species, but oxidative stress. When the body cleans itself of harmful chemicals, which principally happens in the liver, one of the processes involved is the production of reactive oxygen species. These are like bleach in the body, right? Which they have an effect of, trying to keep certain bacteria under control, but they also are produced when there is damage going on in the cells, and they produce damage themselves. So something else that impacts with brain fog is your immune system. Now, your immune system might be upregulated or it might be downregulated. So things that have an immune effect are things like having a food sensitivity, because that can be mediated by IgG or immunoglobulins. An autoimmune condition is going to be another symptom or manifestation of an overactive immune system. But the opposite can also occur. We can have an underactive immune system, and so our tolerance is not what it should be, and so we don't detect pathogens, so bacteria and viruses, and deal with them appropriately, and so they can enter cells and cause damage. Another sort of key mechanism effect is inflammation, neuroinflammation in the brain. And so inflammation is a field change, and it happens, it can be useful for fighting certain bacteria and microorganisms, but when it's not, when it continues beyond taking care of a specific job, then it becomes problematic. And then the blood-brain barrier as well. So this is the barrier between the circulation and entering the brain tissue. When that is disrupted, that can affect, that has a very protective role. So when you have a leaky blood-brain barrier, then there are molecules entering the brain that ordinarily wouldn't, and so they can trigger downstream effects like an immune response. So there are lots of different effects that occur that can impact the brain function and lead to something like brain fog. So what are the events that cause some of these effects, right? Food is huge, right? There are foods operates on many different levels, okay? There are foods that are problematic, and then there are solution foods, and then there are food practices that are healthy. So in the case of problem foods, you mentioned gluten sensitivity, right, as being a cause of your symptoms. There's been a lot of research by Alessio Fasano and others who demonstrate that in 100% of people, gluten causes an increase in the permeability of barriers, right? And so what that means is that the gut lining becomes leaky. So I can't tell you the number of times I've spoken to patients and they're like, oh, no, I'm fine with gluten, right? And then after a while of getting clean in terms of sorting out lots of problems, only at that point do they notice that, oh, okay, gluten is having an effect, right? So that when you look microscopically at the gut lining, everybody reacts to gluten, but you might not be aware of it because, you know, it depends on what else you've got going on. So problem foods, gluten. Other problem foods, refined foods. Refined foods, again, they cause trouble on many, many different levels. What does it mean by refined foods? Essentially, when you take something out of a whole food that's grown in the ground, then it becomes refined. So a whole food is something you can go out and pick from a tree or dig up from the ground, right? So let's talk about an olive or something. So when you crush an olive and you extract the oil and you throw away the pulp, then that's a process of refining. When with grains, which is very common, you take away the bran and the husk and you just leave the inner carbohydrate, so you have white flour instead of whole flour, that's a process of refining. So these are foods that cause triggers within the body that affect our brain function. And then there are beneficial practices to do with food. So things like fasting. When, you know, fasting has each of these things we could have a separate podcast on, right? So just to kind of touch the umbrella.
And we will.
Fantastic. And I trust you that will happen.
And I just want to tell listeners, if everything Dr. Adigo just touched upon, it really feels she's describing my case and what things helped and how it felt and in so much details. So show us some love, give this video a like or this podcast, and do go and follow Dr. Adigo practice on social media. I'll leave the details in the description below. Anyway, back to you. Things we can do with food to help us.
Yeah, exactly. Thank you for that. So yes, we talked about fasting being absolutely beneficial. Another helpful practice when it comes to food is what time of the day that you eat. So the body has cycles of when it produces digestive enzymes. So it's like a factory starting up in the morning. You have to switch all the engines on and put the electricity on. And so your body is able to digest food earlier in the day more than later in the day, right? And there are lots of studies that show that you can eat exact same thing, but if you eat it at 8 p.m., it has a very different effect in the body than if you eat it at 8 a.m. And then another helpful food practice is mindful eating, how you eat, chewing your food in order to ensure that the digestive enzymes are mixing with the food, not rushing your food, being in a state that you're able to receive the food, that your vagus nerve is able to sort out digestion. All right, so not rushing around whilst you're eating, whilst you're rushing around, but sitting at a table to eat. So they are helpful practices that are to do with food. So we're talking about the events that can have some of the effects that we talked about earlier. So another event is perhaps sleep. Sleep is huge when it comes to brain function. Okay, so when we're asleep is the time that we are clearing out a lot of the garbage, the toxins that have built up in the body. There is a lymphatic system, fluid that bathes the brain. And that fluid is changed, if you will, 70% whilst you're asleep. If you're not sleeping adequately, then you're not getting that flushing of the fluid through. And so you can get buildup that occurs over time, which can lead to trouble. Another event that happens to us is at birth, right? So we're born with certain genes. Well, in fact, it happens when the egg meets the sperm, right? Because you have half of your genetic material from your mum and half of your genetic material from your dad. And in that coming together, the encoding of our genes occurs. And some of us have certain genes that mean that some of our chemical pathways are not as effective as with other people. And then that means that we might be more susceptible to things like toxins. You know, if we have exposed to heavy metals in the environment, two people, same amount of exposure, but one person gets sick, another person doesn't. And that might be because of a genetic predisposition. Stress is huge. I can't stress this enough. And stress is just such a big subject because, again, stress starts in utero. If a mother is stressed when she's carrying a child, that child is likely to have a higher rate of chronic diseases throughout their life. So that just shows you through epigenetics the long-term impact of stress. So it's not just your mother's health. As a child, if you have traumatic events, adverse childhood events, whether that's a dysfunctional home situation or some sort of abuse, again, you're more likely to develop conditions like cancer later in life, dementia later in life. So there's the stress that occurs in utero, stress that occurs in childhood, and then there are major life events and day-to-day stresses. All of these are psychological stresses that impact your health in a very real and direct way. Another event that can occur with us is infection. Now, infection is a funny one because even that notion of infection is changing. When we think about infection, we think, oh, was there a time I got this illness and I was sick for ages and I was in bed? And sometimes people don't notice that. And the reason is that there is a continuum between dysbiosis and infection, right? So in some cases, yes, there is that sort of an illness that comes, bang, like malaria. But in other cases, it might be that the balance in the gut has become skewed so that there is more growth of a particular microorganism compared to the other organisms causing the population, and then they can cause that. Just that imbalance can cause problems. So there's the infection dysbiosis continuum going on. When we're talking about brain fog and brain function, have you had an injury in the past? We think about an injury as occurring and then that's it. But injuries can have long-term effects, particularly brain injuries, because they change the balance in the system. And sometimes we're on a merry-go-round because we can never really find that equilibrium again. Other events that happen, I mentioned toxins interfering with mitochondrial function. So toxic exposure. Now that happens, yes, there is the kind of energetic toxic exposure with bad relationships, but we've actually got real toxins as well in terms of chemicals. So in the air that we're breathing, do you live in a polluted city where you're breathing in lots of carbon monoxide or particulate matter? What is the quality of the water you're drinking? There are many substances that are in drinking water that can interfere with our health. The food that you're eating, where was it grown? Was it sprayed with chemicals, pesticides, herbicides? All of these toxins, when taken into the body, can have an impact. Another thing that's not really well recognized is airflow impairment. So how freely do you breathe? And that might seem, what is she talking about? But a lot of us have a chronic oxygen debt for different reasons. It might be that we're so tense a lot of the time that we're shallow breathing. We're not taking nice deep breaths throughout the day. But then others of us have a collapsible tissues around our throat. And so when we're asleep and we're snoring, that interferes with our body's ability to take the oxygen that we need. And over time, just having that less oxygen that you need, you will run into trouble, particularly with your energy production. So, and then, a natural way of event that happens around us is the diurnal rhythm, the day-night cycle. Nature is all about rhythm. We have seasons, autumn, spring, summer, winter. We have the earth rotating on its axis and rotating around the sun. We have, plants having times where they blossom and then fall back. So nature is all about rhythms, and those rhythms, we are all about rhythms as well. So during the day, as I've talked about with digestive enzymes, sometimes we're producing more enzymes than not, but particularly with hormones, at different points in the day, our hormone levels change. And some hormones are higher at one point and lower at another. And then it changes from hormone to hormone. And hormones, really, they're like a control center for the body. And so I know I've heard you say in the past, Idan, that you notice you have higher energy levels, maybe at about 5-6 p.m. Again, your hormone profile is changing during that time. So it might be that whatever profile you have at that time of the day is actually suiting what else is going on in your body. So these are some of the events that occur in our lives that have the effects that we talked about earlier. And so the good news is that there are many ways that you can feed in order to improve your health by optimizing these levels. Is that too much? Does that make sense?
It makes so much sense, and it's so easy to relate to. You're just talking about natural processes that make sense, I think, to most of us if we listen to our body and lived a little bit. It's thank you very much for this detailed approach, and I can see the clear benefits when you go to a practitioner, to a doctor, and they're covering with you all of these aspects. And of course, how can you stop getting burnt if you haven't learned that the oven is hot and you shouldn't have your hand there, even though you can get the aloe vera gel afterwards or whatever? Just learn to work with your body.
That's such a key point, Idan, because it might be overwhelming to think, oh, that there's so much. How am I going to, but these are things we're doing every day. And the other point about that is the point about there is no such thing as disease, almost, in the sense that with all of that going on, everybody's going to be different, right? And so when you say everybody with this disease should do this, that's a nonsense, because where you have a good diet, you might be really poor in terms of your sleep hygiene, or you might have an issue with snoring. And so that blueprint per person is what allows you to zone in on the things that are going to make the biggest difference for you. And I think there are pillars that we can put in place that will help most people get 60, 70% better. But then there's some fine-tuning that occurs that requires a deep dive into what is happening for you.
Absolutely. And what I want to touch on here is one thing is if you find it overwhelming, as many people find which I speak to, unfortunately we have to take health into our own hands. It's our body, and if we don't look after it, it's not going to be looked after. If we pick up a cigarette each time, or we take another glass of alcoholic beverage, or too many coffees, too much gluten, too much sugar, oils, then the body, it can't. You can have this good doctor and people helping you, but if you're not doing the effort, it's just not going to happen. Where possible, I was in a position where it wasn't possible to walk every day or every week, or probably sometimes even a month or two. But when it's possible, for those of us who are able to walk a little bit, I can emphasize it's the most natural form of exercise and of being, just to walk. You touched on breathing. All babies breathe through the nose. If the nose get blocked, big trouble. Breathe through your nose. Practice that. If you snore, go and get it checked. Make sure there's not collapsed tissues there, which reducing your oxygen. There's so many of what you touch. We really have to pay attention, and it's absolutely fine to seek help and guidance. That's why Dr. Adigo exists, and just a few others, but there's a few others like her in your area as well, or you can do online consultations. And if you're not able to afford, then that's one thing. But if you're able to afford something, then you should, because what's the price of not working? Like me, I wish I had someone like Dr. Adigo as I was getting and falling between the chairs and sinking basically, to support me. I was teaching psychology at the university. I had a bit of salary. I was doing some other work as well, but I just wasn't aware of this kind. So there's a price to being ill as well. So do try to find time, resources to sort it if you can, where appropriate. And I want to touch also about stress and traumas and things like that. Obviously, my background is psychology and some hypnotherapy as well, and even counseling. That's actually how I started my journey into psychology, through counseling. If you feel life is overwhelming you and you had not the best of beginning in life, and it doesn't matter how little, small, complicated or simple it may seem to you, and oh no, these people have been through a lot worse. It doesn't matter. It's how we as people deal with it. And I can't recommend enough to seek help. You can contact Dr. Adigo. Now we have her, and I will put the details below. We can seek people like Dr. John Butler. He's a psychologist, hypnotherapist, counselor, and addressing and trying to work with what we've been through is so important before we can bloom. These things hold us back. So it's incredible what you do, and how many things you touch, and how complex it, how much we owe it to ourselves to sleep the 7, 8, 9 hours, 10 hours, however many hours our body require, to push ourselves. And yes, life is complex, and I can hear some people it will be easier for them to change, some people will struggle, but we have to prioritize. I can give a personal for myself as a young person. I used to like to have a car, a motorbike, a nice watch, and I used to work for that. And I would think, oh no, I can't go to do something that maybe sounded far-fetched, like a spa for a day or two, just to relax and or to see a counselor. And I would say, what? I spent at the time was £30 an hour for counseling, just for a dog. But yet to work for a watch, for a new motorbike, I would find easy. So it's not everyone like that, but we can look at our priorities as well. And also, if it may not be a financial, it may be a time thing, but I gotta pick up the kids from school, I gotta feed my wife, I have to cook for her, or whatever. We have to find the time to cook a healthy meal for ourselves and those around us if possible. And if they're interested, we have to put ourselves first, because if we're not well and good, we can't help no one. As selfish as it may sound, if we are broken, how can we be any good to anyone else? So these are a few things that yes, it's just make it. I really appreciate what you're covering and how you're doing things. With the chemicals, if you spray what people spray in the bathroom, toilet spray, air freshener, you basically see me have the biggest allergy attack, short of breath. I can't breathe, I wheeze, my eyes water, my nose runny, my face is like having a twitch and an attack. The same with perfume, deodorants. Often these things are not regulated, even I believe. It should be banned, absolutely. Those chemicals, what they're doing to our atmosphere, to the air. So that's as well. Look into multiple chemical sensitivity. I'm sure that's something you practice in your practice, covering your really pay attention to that. Don't put things on your body if you don't want to eat them. Why do you put them on your skin? Your skin probably absorb. You're a plastic surgeon. You know how this works. So I think once you start diving into your body and into health, you will sing a similar song to me and Adigo. It's just the nature of the things. It's going back to nature. And if you feel it's extreme not to use a nice smell, perfume, aftershave, shampoo, deodorant, it's extreme to eat a clean, just a nice bowl of porridge with fruits for breakfast rather than egg and bacon or something. But the thing is, if you go a couple of 1,000 years back, it's extreme how we live now. It's extreme to us because we just been slowly moving towards that killing zone, killing of ourselves, really. But it is extreme to people a few hundred years ago. To do all the things that we do. Even washing your clothes, there's so much details you can go into, chemicals, how they seep into us. And a lot of skin conditions can clear as well, I believe, when you do that. So I think I'd definitely like to have you back, and we can go into more detail, maybe a small presentation, how just to get started. So we'll do that. And anything else you would like to add? It's already so much you've given us, and I'm very grateful, and it's very helpful. And also for those of us who are trying always to get better, it's just helpful knowing there's people like you there that trying your best to solve our condition and help, and anyone who's struggling. It's just very nice to know there's people so genuine and caring and working hard to try to resolve from the source what we're dealing with.
Yeah, I love your encouragement to everyone to look after themselves in whatever way they can, and I would second that. This is about self-care, and we've lost touch with the fact that we have the power to have our health in our hands. We've grown up with an idea that disease is something that happens to us and that we are helpless in the face of disease, and that the only thing we can do is to go and find a pill to take to relieve the symptoms. But you weren't born with disease. Most chronic diseases occurred later in your life. Something happened to you in order for that disease to occur. And so if you can have the mindset, be an investigator in your life, really ask questions. It's not so popular in modern life as well. We have an authoritarian mindset where we believe people in authority, and so we take it as read. But ask questions, try and understand why am I having this? Why did this start now and it wasn't there 10 years ago? Really be inquisitive. And yes, it's great to have guidance and support, but really cost isn't a barrier to helping yourself get better. There are so many resources, and I think we're in a time where the abundance of information, it has its challenges because there's a lot out there as well that is dubious, but there's also a lot of useful information. So tap into resources like Idan's podcast, groups online. So form a community to support you in your healing. And none of these things take a lot of time as well. Yes, we're all busy, we have a lot of stresses, but find whatever you can do, whether it's 10 minutes to sit in silence, just to gather yourself a day, whether it's walking to the shop rather than jumping in the car, whatever you have leeway to do, find it. So there's always something that you can do to help yourself feel better. And when you feel that little bit better, that gives you the wherewithal to do a little more. So I would, encourage you to, whatever avenues you have for self-care, please take them. And that community, that support, that relationship, we're so isolated in modern life that we miss that. And I think that is also a very important part and aspect to our healing, our psychology and our general well-being. So they're the things that I would emphasize. And of course, the food issue is a whole big other topic, but many resources out there about, in headline, eat a whole food, plant-based, plant-rich diet as a baseline.
Amazing. I think there's no more beautiful way to leave our audience with that conclusion. Just do what you can, find ways to have a bit of time to yourselves. So thank you very much for this chat today and all this information. And I will leave resources in the description below. And please, I think you are phenomenal. So do go follow Dr. Adigo and give us a like. Let's share this message and this episode for those who can benefit from that. Thank you so much, Dr. Adigo, for being with me here today.
It's been my pleasure. Totally delighted to be with you.